Today I wanted to talk about the difference of what's called a swimmer's ear or an external ear infection and a more typical middle ear infection, or what we often think of just ear infections with little kids. So swimmer's ear, an external ear infection, involves the space between the external ear, that opening, to the tympanic membrane or the eardrum, along that canal itself. What happens with that is that canal, which is lined with skin, starts getting really inflamed and infected. Kids can sometimes manifest it as having pain when they chew or when they're talking, or classically, they may have pain right here. The best way to treat that initially is to use some topical ear drops, which can get a concentrated antibiotic right to that source right there. When it gets really bad, then a pediatrician will say, why don't we have you go and see ENT, because there's just no way for those drops to get in. And at times we'll go ahead and assess the ear, take a look at it. We even have a couple of special instruments in our office to be able to take a look, and we can do some more treatment there and then at that time and recommend a good course of treatment afterwards. The more classic ear infection is what we call a middle ear infection, and that's where pus and fluid builds up behind the eardrum, or what we call the tympanic membrane. That typically occurs when we start to have upper respiratory symptoms, a cough, a cold, lots of snotty nose. And at that point, as symptoms continue to get worse, many parents will go see either their pediatrician or they'll go see urgent care. There, your healthcare provider will take a look at the ears and look for if there's a red, pussed out, bulging eardrum, which is the classic signs for having an ear infection, and at that time may prescribe an oral antibiotic. Ear infections are very common, so if you have concerns that your child has an ear infection, be it an external ear infection or a middle ear infection, give us a call, come on in, and we'll be happy to take care of them.